Have you ever caught yourself wondering, quietly, maybe even with a bit of hesitation, if the way you've been pleasuring yourself is still the right way for your body? Especially now, after 60, you're not alone. In fact, what if the discomfort you've been feeling isn't about age at all, but about not having been taught how to adapt? That question sits in the silence of so many men's minds as they grow older. It lingers not just in the bedroom, but in moments of solitude, in early mornings, or late nights, when something doesn't feel the same. Maybe it's that arousal feels slower, or that climax doesn't carry the same release, or maybe it's just a feeling, a vague sense that something has shifted, and no one ever explained what to do next. I'm Dr. Maya Kapoor, and if that's your experience, I want you to know you are absolutely not alone, and you are definitely not broken. I've spent more than 25 years working with men just like you, men in their 60s, 70s, and beyond, who want to remain connected to their bodies, who want to age with dignity and clarity, who want to keep their sense of masculinity and pleasure alive. And one of the most common questions I get in private conversations, the ones men rarely bring up even with their closest friends, is this: is it still okay for me to masturbate? Is it still good for me? Or could it be doing harm? Not only is it okay, it can be essential. Masturbation after 60 isn't something to be ashamed of. It's not a fallback plan. It's not immature. It's a powerful tool for maintaining physical health, hormonal balance, emotional grounding, and even cognitive clarity. But, and this is the part almost no one talks about, it has to be done differently than it was in your 20s or 30s, because your body is different now. It's not weaker, it's wiser, and it requires a new kind of touch, a new kind of attention. Most men go into older age carrying the same habits they developed in adolescence: quick, secretive, goal-oriented, often with tension in the breath, shoulders, and jaw. Those patterns get locked in the nervous system, like grooves in a record. They become so automatic that we forget to question whether they still serve us. And that's where discomfort often begins. Not because masturbation is harmful, but because the way it's being practiced no longer aligns with what the body actually needs. The truth is, masturbation can offer real, measurable health benefits in your 60s and beyond. Gentle, regular stimulation keeps blood flowing to the pelvic region. Like a quiet irrigation system, this circulation nourishes tissues that would otherwise dry out, keeping not just the penis, but also the surrounding muscles and nerves healthy and alive. It helps maintain elasticity in the erectile tissue. It reduces stress hormones like cortisol and increases feel-good neurotransmitters like dopamine and oxytocin. It even supports better sleep by calming the nervous system. In other words, self-pleasure, when done consciously, can be part of your daily or weekly health regimen, just like walking, eating clean, or doing stretches for your lower back. But here's what most men never get told. What used to feel good at 30 might not feel the same, or feel good at all when you're 65. And that doesn't mean something's wrong. It means your nervous system has evolved. Your skin is thinner now. Your blood vessels may be more reactive. Your arousal curve is different. You may need more warmth, more breath, more presence, less force, less urgency. That's why I want to begin this conversation by talking about the first major mistake most older men make without realizing it: rushing. Now, this might sound too simple to matter, but I assure you, the consequences of rushing go far deeper than people realize. When you approach masturbation with speed, whether out of habit, shame, boredom, or just trying to get it over with, you're activating your sympathetic nervous system. That's your fight or flight mode. It tightens your muscles. It narrows your blood vessels. It speeds up your heart in a way that mimics stress, not pleasure. And the result? Blood doesn't flow deeply into the genitals. The pelvic floor stays tense. Your breathing becomes shallow. And you may climax, but the experience is flat, disconnected, even unsatisfying. And the more often it happens, the more it begins to shape your nervous system, not toward pleasure, but toward defense. Worse, if this becomes a repeated pattern, your body starts to associate touch not with safety or release, but with pressure and tension. The next time you try to connect with yourself, it feels harder. It takes longer. You start to worry. And so you rush again. It becomes a self-perpetuating cycle of frustration and numbness. But when you slow down, everything changes. By simply giving yourself more time, 5 minutes, 10 minutes, without distraction, you shift your entire nervous system into parasympathetic mode. That's your rest and digest state, the place where healing happens, the place where arousal deepens. Your blood vessels dilate, your pelvic muscles soften, your breathing becomes full, your brain signals to your body, you're safe, it's okay to feel, and in that safety, the skin becomes more sensitive, the nerves start to respond, and pleasure, real, nourishing, satisfying pleasure, has a chance to return. One of my patients, Walter, once told me, I used to treat it like scratching an itch. Now it feels more like taking a walk. And that shift changed everything for him, not just in sensation, but in how he saw himself, more calm, more confident, more present. So if you found yourself feeling rushed or numb, or like it's just not worth it anymore, I invite you to ask yourself, am I giving my body the time it needs to feel again? Because sometimes the answer isn't in a technique or a pill. Sometimes it's just in choosing to slow down. This isn't about turning your bedroom into a spa or performing some ritual. It's about offering your body the same attention you'd give to something you truly care about. You don't rush a good meal. You don't rush a walk in nature. Why rush this? This isn't indulgence. It's not shame. It's not something to feel guilty about. It's care. Quiet, honest care for the body that has carried you through every version of yourself. So the next time you reach for yourself, I want you to breathe, to pause, to touch slowly. Not because you're trying to prolong anything, but because you're finally allowing yourself to arrive. And in that space of arrival, something beautiful begins to happen. Your body starts to trust you again, not just in how you move, but in how you feel. But even as you slow down, there's another habit that many men unknowingly carry with them. A habit that seems harmless until it slowly trains your body to forget what pleasure really is. And it starts with something as simple as the way you touch. After we begin to slow down and rediscover the rhythm of presence, we have to turn our attention to another habit many men develop over time without even realizing its cost, the habit of using too much pressure. It starts subtly. You may not notice it until the day your body simply doesn't respond the way it used to. Sensation feels dulled. Erection is possible, but pleasure is muted. What do most men instinctively do in response to this change? They tighten their grip. They move faster. They increase the intensity, not because they want to hurt themselves, but because they desperately want to feel something again. Unfortunately, this is often the beginning of a cycle that slowly robs the body of the very sensitivity they're trying to recover. The penis is not designed to withstand aggressive or repetitive mechanical force over decades. It's made of incredibly delicate spongy tissue. lined with blood vessels and wrapped in nerve-dense skin that responds best to warmth, blood flow, and gentle rhythmic stimulation. When you apply too much pressure, especially the same tight grip, in the same way, every time, you're placing stress on tissue that thrives on relaxation. Over time, that stress causes microscopic trauma, nerve desensitization, reduced blood flow, subtle damage to the fascia, even scarring in some cases. You don't see it from the outside, but you feel it slowly through the fading of pleasure, the resistance to arousal, and a growing sense of disconnection. I've had patients describe it with words like numb, dull, or even frustrating. One man, James, told me, "I have no problem getting hard, but I can't feel much anymore unless I grip with full force." He wasn't alone. In fact, this is one of the most common complaints I hear in my practice, and one of the easiest to overlook because the damage isn't sudden, it's quiet, gradual, invisible, until it becomes deeply ingrained in the way you experience your body. The term some men use is death grip syndrome. It's not a clinical diagnosis, but it reflects a very real experience. When the body becomes trained to only respond to one very specific kind of stimulation, typically intense, fast, and tight, so that all other forms of touch feel empty or ineffective. But the good news is this: your body can adapt. It can relearn. It can rebuild sensitivity if given the right environment. When I worked with James, we didn't do anything complicated. We simply loosened the grip. We slowed the motion. We replaced dry friction with a soft, warm lubricant. He practiced touching himself with less urgency, more breath, and more curiosity. And over time, something shifted, not just in his erection, but in his emotional relationship with his body. He told me, for the first time in years, I didn't feel like I was rushing towards something. I just felt. That is where healing begins, not with pressure, not with performance, but with presence. And that leads us to perhaps the most overlooked mistake of all, the one that exists not in your hands or your skin, but in your heart, the mistake of emotional disconnection. Most older men were never taught that touch could be emotional. That self-pleasure wasn't just a release, but a kind of self-relationship. And so, without realizing it, they carry old beliefs into the present moment. Beliefs that say, "This is shameful, this doesn't matter," or "This isn't appropriate at my age." These beliefs don't disappear just because the body still wants connection. They sit quietly in the background, turning what could be a moment of comfort into something mechanical, disconnected, or guilt-ridden. I've seen men go through the motions of touching themselves, but with a hollow look in their eyes. They climax but don't feel satisfaction. They touch their body but avoid feeling their emotions. This is where deeper disconnection sets in. Because your nervous system doesn't separate physical and emotional experiences, it weaves them together. If you're touching yourself while emotionally shut down, your body eventually learns that pleasure equals numbness. That touch equals absence. That release equals nothingness. And that is not a neutral outcome. It is a slow form of emotional erosion. One man I worked with, Alan, had gone almost 2 years without any kind of intimacy. Not with a partner, not even with himself. His wife had passed away, and he told me it just felt wrong to do anything alone. He wasn't in pain, he wasn't broken, but something in him was dim. As we talked, I asked him a simple question. Do you think you stopped because of grief, or because you stopped believing you were allowed to feel joy? His eyes welled up. That was the turning point. I didn't give him a technique or a timeline. I gave him permission to reconnect, not out of lust, out of remembrance, out of honoring the part of him that was still alive. A few weeks later, Alan told me, I didn't just feel physical pleasure. I felt warmth. I felt like myself again. That's what emotional reconnection does. It brings back the color, the pulse, the humanity, and that is far more powerful than any climax. So how do you begin to re-enter your body emotionally after years of disconnect? It's simple, but profound. Before you touch yourself, pause. Place your hand on your heart or your belly. Take a breath. Ask yourself gently, how am I feeling right now? You don't need to fix anything, just acknowledge it. Are you anxious, lonely, tired, tender? Let that emotion stay in the room with you. Let it be part of the experience, not something to push aside. And when you begin to touch yourself, do so as if you were comforting someone you deeply loved, not to get them somewhere, not to make something happen, but to simply be there with them. That's how you rebuild trust with your own body. That's how you begin to feel again, not just physically, but emotionally. That's how your nervous system shifts from survival to softness, from shutdown to safety. There's a kind of quiet healing that happens when a man begins to treat his own body with the same reverence he once reserved only for others. It's not about being selfish. It's about being whole. And when you bring that level of care into your most private moments, your body remembers how to respond, not with urgency, but with gratitude. You don't need to chase sensation. You need to slow down long enough to let it arrive. And when it does, it may feel different than before, quieter, slower, deeper. But that's the beauty of it, because the pleasure that returns in your 60s and beyond isn't adolescent, it's mature, grounded, honest, and real. Now that we've explored the 3 biggest mistakes, rushing, using too much pressure, and emotionally disconnecting, let's shift into something more hopeful, more actionable, because avoiding harm is only half the story. The other half is about building a new relationship with your body, one rooted in care, one that evolves with age, one that says you're still here and you still matter. Let me show you what a healthy, restorative self-pleasure routine can look like. It doesn't require supplements. It doesn't depend on libido. And it certainly doesn't need to feel like a performance. It's just about giving your body what it's quietly asking for. It starts with a simple setting: clean hands, a quiet room, a space where you don't feel rushed or judged. No harsh lighting, no multitasking. This is time for you, with you. If you use tools like a towel, a sleeve, a pillow, keep them clean. Treat this like any other form of hygiene and care. Now, you'll want to use a natural, unscented lubricant. Coconut oil works beautifully for some men. Others prefer water-based. What matters most is that it reduces friction and increases ease, because your skin isn't 30 anymore. It deserves comfort, and so do you. As you begin, don't rush to the genitals. That might have worked in your 20s, but now your body needs time to warm up. Think of this like preheating an oven, not for intensity, but for receptivity. Start with your thighs, your belly, even your neck or chest. Gentle strokes, light pressure. Let sensation wake up slowly without expectations. If you've been gripping too tightly for years, this part may feel unfamiliar at first. That's okay. Your nerves are not broken. They're just sleepy. You're not failing. You're reintroducing your body to a new way of receiving. And when you finally do touch your genitals, go slow. Don't recreate old patterns. Create new ones. Try different rhythms. Explore touch without always heading for climax. You can pause. You can breathe. You can feel the difference between chasing and receiving. If climax happens, that's wonderful. If it doesn't, that's okay too. The goal here isn't release, it's reconnection. And please listen to your body. If something feels off, tightness, irritation, pain, don't push through. These are signs. Your body is speaking. Honor it. I've worked with men who've told me, I haven't touched myself in years, or I've never done it without shame. My answer is always the same. It's never too late to learn a new way. One man, Frank, 73, had stopped entirely, not from illness, but from the quiet belief that it just wasn't for him anymore. His wife had passed. His body felt foreign. He told me, I thought that part of me died with her. But I gently encouraged him to begin again, not from lust, but from care, to meet his own skin like it was something sacred. 3 weeks later, he came back in tears. Doc, he said, I didn't just feel arousal, I felt myself. I felt human again. That's the gift this practice can bring. Not just sensation, but dignity, memory, aliveness. Now, let's talk about red flags, things not to ignore. If you notice swelling, soreness, spots, or persistent discomfort, don't write it off. It may be as simple as overuse or dryness, but it can also be a sign of circulatory issues or inflammation. If something doesn't feel right, talk to a doctor. Not for shame, for safety. You deserve peace of mind. And yes, masturbation can support prostate health, not harm it. Regular ejaculation has been shown to reduce stagnation in the prostate gland and may lower the risk of long-term complications. Think of it as a kind of inner rinse cycle, clearing old fluids, moving energy, and preserving hormonal flow. But the benefits aren't only physical. Orgasms, whether through touch or fantasy, release powerful chemicals: oxytocin, dopamine, serotonin. These aren't just feel-good hormones. They're antidepressants, sleep enhancers, pain reducers. They help with memory, immune function, and even cardiovascular health. And beyond that, they help you feel alive. They remind you that your body is not just a vessel. It's a source of joy, comfort, and presence, even now, especially now. Because here's something most men never hear. Your sexual expression doesn't expire. It just evolves. You're not 25, and you're not meant to be. You're wiser. You're deeper. You've lived through years of joy and loss, of partnership and solitude. And now, your relationship with your body can reflect that depth. It can be slow, reverent, mindful. Less about climax, more about coming home. So tonight or whenever you feel ready, give yourself permission to be present, to be gentle, to be whole. Touch yourself the way you'd hold someone you love who's been through a lot, because that's exactly who you are. And if it feels awkward at first, don't stop. Keep listening, keep breathing. Let your body rebuild trust in your hands, because this isn't just about masturbation. This is about reminding your nervous system that it's still safe to feel. And if you're wondering where to begin, how to turn everything we've talked about into something real, something personal, start simple. Set aside just one intentional session a week. Nothing complicated, just you and a bit of quiet. Give yourself 15 minutes, no pressure, no expectations, no finish line to chase. Just explore. Breathe deeply, in through your nose, out through your mouth. Let your body know this is not a performance. This is presence. Let your focus shift from how fast your hands are moving to how warm your skin feels. From what you're supposed to feel to what you're actually feeling. And when you're done, whether you climax or not, take a breath and simply say, thank you. Thank you to your body, to your breath, to yourself. It may sound small, even silly, but that single act of gratitude changes everything. It turns routine into ritual. It turns old shame into quiet healing. It reminds you, you are still here. You are still worthy. You are still alive. So if no one said it to you lately, let me say it now. You are not broken. You are not past your prime. You are not invisible. You are a man with history, with tenderness, with so much more to give. And how you treat your body, especially in these private moments, reflects what you believe you deserve. This isn't about performance, it's about respect. And I promise you, when you begin touching yourself with kindness instead of pressure, with curiosity instead of speed, your body will remember how to respond. Maybe not all at once, but slowly and surely. And what you'll rediscover over time won't just be pleasure, it'll be peace, a deeper sense of belonging, a quiet knowing that this body of yours, yes, even now, still belongs to you. If this message spoke to something in you today, I hope you'll take the first step. Breathe, begin slowly, and be gentle with yourself. And if you found this video helpful, please consider subscribing. Share it with a friend who might need to hear it. Leave a comment to let me know what resonated most with you. Until next time, stay strong, stay gentle, and take good care of yourself.